So let's take a look at a few specific method examples. The first one I would like to show you is the antiretroviral drugs. So worldwide, an estimated of 37 million people are HIV positive, and the majority is living in the sub-Saharan region of Africa. Medication of antiretroviral drugs lead to viral suppression, and this really improves the quality of life. So they can live a normal life if they respond to the treatment and if the treatment is adjusted to their personal level. The problem comes if it's not adjusted to the personal level, so if there's no therapeutic drug monitoring being done, then some patients they're at risk of developing drug resistance for these antiretroviral drugs. And to avoid this, we suggested to make this with our method, with dry blood spot samples. So here we ran a study in collaboration with the Swiss Tropical Institute. They are very active in Tanzania, Africa. A lot of samples were drawn there and shipped to a centralized laboratory in Switzerland. So here we really have an example of an application where we have large amounts of samples, and then we also have a large distances the sample have to travel. And while drawing, they were really in a remote area in Tanzania, and the samples, by getting to Switzerland, they went through different climate zones from very hot to very cold and different stages of humidity. And we saw that the samples were very stable for all the way, which we assessed in a cross-validation. So the University Hospital of Basel, they developed an assay which goes 5 minutes per sample, also 20 microliter extraction, and the clinical validation is successful. And the details I will show you on the next few slides. So the separation of the 3 antiretroviral drugs, nebivolin, evivorez, and lopinavir, was achieved on a Kinetex F5 column. So we have aromatic ring with 5-fluor attached. The extraction solvent was 70% methanol in water, and the chromatographic separation was being done with methanol and water. So you can see that we use a very high content of organic solvent for the extraction. And this is because we only want to dissolve the molecules we are also targeting. So by this, we only dissolve the small molecules, the small drugs, and the large proteins, albumin, etc., we leave back on the dry blood spot. So it's a very selective and targeted extraction, which gives us a first step of purification, followed then by a filter and a pre-column and the column. For the method itself, we can see in the upper left part, we used a combination of positive and negative AZ windows. So first we had the positive window, then we switched to negative and back to positive. And by having this very small time window, we were able to really get the peaks with very good sensitivity and very nice peak shapes. So afterwards, a human study then was performed with the samples from Tanzania. In the first step, 90 DBS samples were analyzed, and concentrations of all the 3 drugs were found in different levels. Overall, the extraction showed very good agreement, and the effect of hematocrit was also assessed, but the usage of internal standards coped for this effect. So the trick here was to prepare the calibration concentration with a medium hematocrit of the whole population which was observed. And by having this medium calibrator range, the analytical guidelines for method validations were met. Here as well, we knew the hematocrit value of each patient, because this was also assessed during the sample drawing, and this was then also adjusted, but there was no need for this to integrate this into this method, because also without this, the effect was nullified by this internal standard sprayer and by preparing the calibrators with a medium hematocrit level.